Hello, I'm Dr. Melvin, and I want to talk to you about the typical process of going through a knee replacement with me. If knee replacement is right for you and you decide to move forward, you'll begin by communicating with my assistant to discuss surgical dates and timing. Once you pick a surgery date, you'll be invited to download a patient engagement app called Patient IQ. This is one of the main ways we educate you before surgery and guide you through the recovery process after surgery. We encourage you to use it. Before the operation, you'll also be required to see your primary care physician and possibly specialists like a cardiologist for a pre-op evaluation to make sure you're ready for surgery. This usually happens about 30 days before the operation. In most cases, we're able to arrange for a physical therapist to come out to your house before surgery to do a pre-operative home assessment. We found this to be very helpful in getting you both mentally and physically prepared for the operation. And usually the same physical therapist will come out to see you in your home for a number of visits after the surgery. The surgery can be done as an outpatient or with an overnight stay in the hospital. We'll make that decision together. Regardless of the location, the surgery is typically done with a spinal anesthetic. You'll also receive sedation so that you're sleeping during the surgery, but we don't have to breathe for you. We can usually avoid general anesthesia in most cases, which is preferable. I will also inject numbing medication throughout your knee during the surgery as well to help with pain control. The surgery usually takes about an hour to an hour and a half to do. For patients going home the same day, you'll head to the recovery room. It takes about an hour for the spinal to wear off and legs to wake back up. At that point, you'll do some walking with the nurse, and usually between 2 to 3 hours after coming out of the operating room, you're in a car and you're heading home. Physical therapy is typically set up to arrive at your home the next day. Hello, I'm Dr. Melvin, and in this short video, I'd like to explain to you what we do during a knee replacement. The way to think about a knee replacement is really it's a resurfacing. In arthritis, the knee joint surface is worn out. With a knee replacement, we replace that joint surface with a combination of metal and plastic. We make small cuts on the end of the bone and remove just a few millimeters of the surface of the bone and replace it or resurface it with a piece of metal. On the tibia side, the same thing. We make a small cut here, remove a few millimeters of bone, and resurface it with a piece of metal. In between the two, we snap in a piece of plastic. Not on this model, we also usually put a piece of plastic on the back side of the kneecap, which is not demonstrated here. And that's what we do during a knee replacement. Now, this is just a general summary, and I know this is a lot to take in, but don't worry. You'll receive this information many more times throughout the process, and we're always available to answer questions and offer support for your personal situation.